For years, he's protected you. Now, he's hiding the one thing you need to see. 7 silent signs. One life-changing discovery. Watch before it's too late. He still wags his tail at the door, still waits by the leash. To his owner, everything about him looks exactly the same as always. But watch closely. The jump onto the couch that used to take one motion now takes 2. A pause no one is trained to notice. Dogs didn't evolve to complain. In the wild, a limping animal is a target. So pain gets buried under behavior that looks completely normal. For 3 months, the signs were already there. Slower mornings, shorter walks, each one small enough to explain away on its own. At his last checkup, his blood work came back clean. Weight, stable. On paper, a healthy dog. At home, something didn't add up. His favorite toy still sits by the door. He hasn't picked it up in weeks. He's just older now, became the explanation for everything. He's panting again. The house is 68 degrees. He hasn't moved in an hour. It's easy to miss what doesn't look like an emergency. He's slower because he's old, quieter because he's tired, eating less because it's summer. Every symptom gets its own separate, believable excuse. What if none of these are separate at all? What if there's 7 versions of the same sentence, one your dog can't say out loud? 7 signs. Most owners miss all of them. This is what your senior dog has actually been trying to tell you and what to do next. Sign 1. Hesitation before stares. Not refusal, calculation. A visible pause while he decides if his body can do what it used to do automatically. Sign 2. Less excitement at the leash. He used to spin in circles at the sound of it. Now he simply stands and waits for it to happen. Sign 3. Restless nights. Shifting positions again and again, unable to find one that holds. A private struggle that happens after everyone else is asleep. Sign 4. Eating differently. Not always less, sometimes just slower, tilting his head to one side, favoring the softer kibble at the edge of the bowl. Sign 5. A new irritability. A low growl when touched near the hip, not aggression. A boundary drawn by a body that's learned touch can mean pain. Sign 6. Circling longer before lying down. Testing angles. Shifting weight. What used to be one motion has become a small, repeated negotiation with gravity. Sign 7. He doesn't bark at the door anymore. Not because he's calmer. Because barking costs energy his body is now spending elsewhere, just to get through the day. Stairs, walks, sleep, food, touch, settling, silence. 7 separate moments scattered across one ordinary week that were never separate at all. She hadn't noticed the pattern until she scrolled back. 7 notes, 7 weeks, each one filed under probably nothing. Read together, they told a different story. That's the moment it clicks. Not one bad day. 7 quiet ones, stacked so gradually that noticing them all at once feels like a gut punch. She crosses the room differently this time, not to play, to really look, to ask, for the first time, what he's actually been carrying alone. These 7 signs have a name in veterinary medicine: masked pain behavior. And understanding why dogs mask it changes everything about what to do next. Veterinarians see this constantly. A dog that looks composed on the exam table while quietly compensating for pain most owners never learn to spot. It goes back further than domestication. In the wild, weakness invites predators. So concealment became survival. A program still running in every dog today. Every hour spent masking pain is an hour of energy diverted from healing. Looking fine has a cost, and that cost compounds quietly, day after day. pain reshapes decisions before it reshapes movement. Skipping the stairs, skipping the toy, skipping the bark. All early trade-offs a tired body makes first. Underneath the calm exterior, a nervous system is firing low-grade alarms constantly, not loud enough to whelp, just persistent enough to reshape every movement. Most often, it's arthritis. Cartilage worn thin between joints that have carried this dog for over a decade, each step now landing slightly differently than before. To protect the sore joint, he shifts weight elsewhere. But that new pressure wears down muscles never built for the job. One problem quietly creating another. His tail still wags when you walk in. That reflex survives almost everything. It's not deception. It's the last behavior built to keep the bond intact. Owners are wired to notice yelps and limps, obvious distress. Subtle masking doesn't trigger that same alarm, which is exactly why it goes unnoticed for months. Vets use structured pain scales, scoring gait, posture, appetite, and behavior together. What looks like separate quirks becomes, on paper, a measurable pattern. Left unaddressed, masked pain doesn't stay quiet forever. Mobility narrows further. Muscle wastes faster. What could have been managed early becomes harder to reverse. "He's just getting old" is the most common thing vets hear, and the most dangerous. Age isn't a diagnosis. Most of this is treatable if it's caught. When pain is properly managed, the change is often immediate. Dogs eat more, sleep deeper. Some even start playing again, a return that owners describe as their dog coming back. That possibility exists for him too. Not guaranteed, not instant, but real, and closer than most owners realize once they know what they're looking for. The 7 signs aren't just observations, they're data points. Written down, timed, and brought to a vet, they turn a vague worry into an actionable conversation. But most owners don't go straight to the vet. First, they try to fix it themselves. And most of those well-meaning attempts don't work the way they hope. The first stop is usually the supplement aisle. Glucosamine, fish oil, joint chews. Reasonable first steps, but rarely enough on their own for real pain. Supplements can help joint health over months, but owners are watching for change in days. By the time it might work, most give up on it entirely. Some owners reach for their own painkillers, assuming relief is relief. But many human medications are toxic to dogs, a well-meaning mistake with real risk. Total rest seems logical, so walks stop entirely. But joints and muscles need some movement to stay functional. Too much rest can accelerate the very decline it's meant to prevent. Guilt sometimes swings the other way. Long, ambitious walks meant to make up for lost time. But sudden intensity on a compromised joint often causes a painful flare-up. Extra weight adds direct pressure to already sore joints. It's rarely the sole cause, but it's often the most overlooked lever owners could actually pull sooner. A new orthopedic bed helps with comfort, but it doesn't treat the joint underneath. It's relief for the symptom's surface, not a fix for what's causing it. Sometimes the delay isn't about supplements or beds at all. It's harder to admit. Naming what's happening to a senior dog means facing what comes after. At 1 a.m., she's read 12 articles about senior dog symptoms. Each one slightly different, none of them conclusive enough to make the appointment feel urgent. The real mistake isn't any single fix. It's the question underneath all of them: is this normal aging? The better question is simply, is this treatable? None of this means nothing can be done. It means the fixes need to start in the right place, and that place isn't the supplement aisle. It's the vet's office. This drive feels different than the others. Not dread this time. Direction. For the first time in months, she's not guessing what's wrong. She's finding out. She walks in with the list this time. 7 signs, dated and specific. What used to be a vague worry is now something the vet can actually act on. This time, the exam goes further. Targeted palpation, a closer look at gait, direct questions about the stares, the circling, the growl. And this time, it finds something. Osteoarthritis, a common, manageable condition in senior dogs. Not a crisis, a diagnosis. And a diagnosis means, finally, there's something specific to treat. The plan isn't complicated. A joint medication, a modest diet adjustment, and short, consistent walks instead of long or none at all. Precise, not drastic. That evening, the first dose goes into his food. No ceremony, no music swell. Just a small tablet folded into dinner, the actual beginning of something changing. 2 weeks in, the jump onto the couch takes one motion again. Not perfect, not instant, but real, visible progress in the exact place it first went missing. The tennis ball gets picked up for the first time in months. Not thrown far, not held long, but chosen on purpose, which is its own kind of victory. Over several weeks, a few pounds come off. It doesn't sound like much, but every pound off a sore joint is measurable pressure removed from every single step. The walk stays short at first, exactly as planned. 5 minutes becomes 10. 10 becomes a full loop of the block. Progress built slowly enough to actually hold. The circling before sleep shortens. The shifting through the night stops. For the first time in months, he sleeps in one position until morning light returns. A hand rests near his hip again. No flinch this time, no growl. Just a slow exhale and a shift closer into the touch instead of away from it. A delivery knock comes. This time, he's up before it finishes. One sharp bark, tail already moving. A small, ordinary sound that once went quiet returns. Going forward, the goal isn't panic over every slow morning. It's noticing patterns, clusters of small changes lasting more than a couple weeks, and asking early. The door opens. The tail wags. To anyone watching for the first time, it would look exactly like the beginning of this story. Now, it actually means what it looks like. This was never about assuming the worst. It's about paying attention the way he's always paid attention to you. Quietly, consistently, without needing to be asked. Stares, walks, sleep, food, touch, settling, sound. 7 signs, once scattered and easy to miss, now understood as one connected story with a clear and workable next step. This one conversation, this one adjustment, reshapes what the next few years look like. Not a cure for aging, just years spent without unnecessary, invisible pain. The question that mattered most was simple. Is this new, and has it lasted more than a couple weeks? Asked early enough, it changes everything that follows. Every senior dog carries some version of this same quiet story. Different breeds, different homes, the same evolutionary instinct to hide what hurts most. This week, watch for the 7 signs. Write down anything that lasts more than 2 weeks. Then bring that list to a vet. Not to panic, but to ask. The tail still wags at the door. It always did. The difference now isn't in what you see. It's in everything you finally know how to look for. If this helped you see your own dog a little differently, like this video, share it with another dog owner, and subscribe for more stories worth watching closer.